If you've been diagnosed with or told that you have degenerative joint disease or facet joint problems, well, you likely experience pain on one side of the spine, not right here on these little bumps, we call these the spinous processes, but just off the one side of the spine at whatever level is affected, and you might have some butt pain and or leg pain as well. Then in this video, I'm going to share with you the only exercise that you need to do to solve the problem and feel better. So to kick things off, rather than trying to treat your MRI and fix your facet joint problem, why not just try to fix a yucky motion? For example, if you have facet joint issues, imagine that these blocks right here represent the vertebrae or the bones in your spine. And picture that in both cases, I'm facing that way. So you'd be looking at the bones in my lower back. And if you have a facet joint problem, well, we know lots of people on MRI have these degenerative joint and facet and arthritic issues, but they may or may not feel any pain. So rather than treating the picture, let's help you treat yourself as a person by understanding what motions are going to be painful and what you can do to fix them. So if you have a facet joint problem, these are the facet joints back here on the back side of the spine. If I'm facing this way, this picture right here represents me bending backwards. If you have a facet joint problem or irritation here, well then this will and should cause you problems. If bending backwards, and I'll show you a few ways to do it here in a moment, does not cause you a problem, then you do not have a facet joint problem. You'll have to check out my other videos, which I'll link at some point here, to figure out the most likely source. If bending backwards is yucky, well, what's the opposite of yucky? Well, yummy, or something that feels good. And if bending backwards is that which makes you feel bad, then what's the opposite of backwards? Forwards. And so forwards, or the opposite of that which makes you feel bad, can often be the solution. I'm going to show you how to use these concepts and some basic understanding of how blocks come together, or in this case, when we bend the opposite way, we're actually gapping or creating space for your facet joints such you can actually use movement as medicine to heal. Let me show you the 3 ways that we can bend the spine backwards now to just make sure this is actually something that's painful or problematic, which would increase the probability you actually have a facet joint causing your pain. All right, so go ahead and perform this simple 3-part self-movement test to actually make sure and confirm that bending backwards is a problem to begin with. Because then what we're going to do is, assuming it is a problem because you've been told you have facet joint problems, and hopefully your physician brought you through these tests. If they didn't, well, shame on them, all right? Then you're here for a reason, all right? So if the facet joints are a problem, we just talked about how when you bend backwards, you're gonna close down on them. So first test is pretty straightforward. Stand with your hands just like this on your hips, and then feet shoulder width apart, and bend straight backwards. Often this is painful and problematic. If it is, then write that down. Get an idea of how bad that motion is. Is it low painful? Is it medium painful? Is it high painful? Just take a snapshot and get a feeling after doing 1 or 2 reps of how yucky it is. Now, sometimes that's not enough. Sometimes it's not enough to provoke the facet joint, which is the issue. Again, usually it's just off the one side of the spine. And so if I have a left-sided facet joint problem, sometimes bending backwards straight back doesn't provoke it. Instead, what I need to do is I need to rotate to the painful side, kind of close down on that joint, and then extend back. We call this a rotation extension test, and often you'll find that rotating and bending back to the painful side where you supposedly have this facet joint problem will provoke your symptoms. If it doesn't, well, there's a high degree certain you don't have facet joint problems and something else is the cause. So we did the center back bend. Now what I want you to do is I want you to rotate and bend straight backwards. We'll just say to the right, see what happens there. Then rotate and bend straight backwards to the left. Again, one of these motions should be painful. Take just one of them, maybe the most painful motion, and record, is it low, medium, or high? All right, that's the first part. Now, I promised I was going to show you the only exercise that you need to do to counteract this. And counteract is a good word because if turning something to the right 5 times makes it tight, righty-tighty, well then turning it to the left often makes it loose. So if bending backwards is tight, painful, restricted, just going the opposite direction, the exact opposite direction, often unjams this or makes it pain-free. So here's the next step. Not only am I going to just tell you and kind of give you this motion, but look, I want you to walk away from this and understand and prove right now immediately during this video that it is actually going to be helpful for you. So this is not like, hey, if you have a facet joint problem, here's this magical exercise. Even though this is going to be painful for many of you, and this is going to be helpful for many of you, for some people, it might not be the best fit. So make sure you follow the process that I'm going to show you. Okay, so here's how we prove that this opposite direction is going to be valuable for you. By the way, the only exercise is simply going to be a forward bend. Now, whether you go to the right or you go to the center or you go to the left, just depends on which motion or which back bend motion was the most problematic. So step one is find the most painful back bend motion, which supports the idea that you have a problem with closing down, in this case, most likely on the joints. Could be something else. Sometimes disc problems don't like to be kind of jammed on either. So it could be multiple things, but let's just go with facet joint problem. Now, instead of treating the diagnosis, we're treating your yucky motion. So let's just say you have trouble bending straight back. We'll call that C for center. You can't see that, and it's okay. Let's just say that you bent straight back, and that was the most painful motion. Then the only motion you need to do, in most cases, is to bend straight forward, the direct opposite. Let's just say you had problems bending back to the right. You did this, and you bent back, and that caused a pain in the back, butt, and/or leg. Well, then what's the opposite of back to the right? Well, forward to the left. So then what you would do is you would take your hand, and you would lean over top of the left knee, because the back right was the problem. So if back into the right is jammed, forward into the left is almost always yummy, pain-free, and safe. And you can hold that position, and we'll talk about for how long, but that would be your motion that I want you to try on within this process. And let's just say bending back to the left was problematic, then you're going to pick forward bend to the right. Go rewatch that if you need to make sure you pick the right direction, all forwards, but is it center? Is it to the forward to the left, or is it forward to the right? Now, you've got your yucky motion. So you did it. Ow! It's low with regards to the amount of pain. You've gotten a snapshot. Now what I want you to do is pick the best direction for you, the one that's complete opposite of the yucky back bend. Let's just say, for example, that straight backwards was the problem. Then I can go ahead and I can just bend straight forward. And if it's to the right for you or if it's to the left for you, go ahead and hold 3 45-second holds. 3 45-second holds, and you're going to go do it right now. You can stop the video and go do that. So you would hold like this. And then, by the way, when you come back on up, use your hands to push on up. Use your hands to hold yourself and push yourself back on up. Why do I recommend this? Because oftentimes you'll say, well, Charlie, I did this motion, but then when I came back up, oh, it caused a lot of pain. Well, that's because you have a yucky back bend. And what is this? It's a yucky back bend. So remove the strain or the stress on the lower back by allowing yourself to get some help from your upper body, from your arms. So you've got a yucky motion. Go do 3 45-second holds of that forward bend. Let's just say you've done that. Now what I want you to do is I want you to immediately retest your yucky motion. So if it was center back bend, standing center back bend, and you did just the straight forward fold, 3 45-second holds, then if this motion is something that could be valuable for you or is likely to help you out, then you should see that it immediately reduces the pain that you feel when you bend backwards. Now, it might not be completely gone, but let's just say 0 to 10, you had a 5 out of 10 when you were bending backwards, but after doing 3 45-second holds, you stood up and now it's a 3 or a 4 or a 2, anything less than it was, then it tells you that motion is not only safe and pain-free. By the way, these motions should be pain-free. I'm not a fan of doing yucky things over and over again, especially if you don't want to feel yucky or in more pain. So they should be safe and pain-free, but it tells us that that thing which you just did is immediately valuable. And it gives us evidence to believe that if something works now in the moment, it may be helpful if we continue to recreate it in the future. Lots of people get this wrong and think that they need to wait weeks or months to try to see results from a specific treatment process or program or whatever it may be. But that's simply not true, and instead that's relying on just hope and prayers that it'll somehow, it didn't work now, it'll somehow work in the future. Just like this light turns on when I push the switch, and if it doesn't, I don't have any reason to believe it's going to turn on magically later. I don't want you to do a treatment which doesn't immediately improve how you feel. When I say how you feel, we're going to objectify that as You had a yucky back bend, you did that thing, that one movement as medicine, 3 45-second holds, and it immediately made your yucky motion better. That's how we can feel confident that this exercise is going to be valuable for you. Now, again, same principles apply. If you had a yucky back bend to the right, you would have done forward bend to the left. Test, treat, retest. If immediately better, take it. If same, not for you. Sorry. You'll have to find some other solution. There's many other motions we could test, all right? It requires testing, though, and not guessing. So throw away a random sheet of exercises and test, treat, retest to find the one thing that's safe, immediately effective, and then we need to talk about the prescription. And obviously, if doing any of these motions immediately made the back bend, whether it be to the right, center, or left, worse, then we don't want to have you do that at home. So only if better will you take this home and will you gobble on it as medicine. And when I say gobble on it as medicine, here's what I mean. Movement is medicine. The goal of taking any medicine or pill is never to take as much as possible, it's to take as little as needed. Therefore, our goal, as you've seen in this video, with the only exercise you need, is not to do a whole sheet of exercises. That wouldn't make any sense. But within that one motion, now we want to find the optimal prescription, just like a pill that you would take. The dose, how much you take. The frequency, how often you do it. And the timing of when you do it has to be dialed in. So as a generic prescription, I'm going to recommend that you do 3 45-second holds of whichever forward motion made most sense for you based off your yucky back bend direction. And that's how much, that's a dose. The frequency, 4 times a day, 4 times a day. So 3 45-second holds 4 times a day. And the timing, when do you do it? This also matters. So if you have a yucky back bend, call it due to facet joint problem or whatever you've been told, and a back bend is yucky, well then how does a back bend show up in life? Well, it's going to show up if you're sitting up tall. That's going to actually make you worse because that is a back bend. You're starting to arch your back in that position. Or it's going to show up when you're walking. This kind of puts you in a little bit of a back bend position, so that can be problematic, sometimes standing. And so let's just say walking would be pretty common to have an issue with. What if you could do a motion, this motion, the only motion you need, that takes 45 seconds to maybe a couple minutes, and you could do it right before you need to go walk, such you can get the relief that you're looking for. So let's just say you know you have to get up and you have to take a walk. Why not take that movement pill now while you're seated? You go ahead, you do maybe just 1 45-second hold, then you stand up and you walk. And knowing that it improves immediately the back bend, we have reason to believe that it'll also fix your ability to back bend in the form of life, walk, for example. So think about the timing of when you take movement or when you choose to use this specific motion that I'm recommending. Try to plant it right before an activity which you know is going to be painful or problematic, prolonged standing, prolonged walking. If you get to the grocery store and you know you got to take a long walk, right? Go ahead on the side of your car, do it, and that will free up or unlock the back bend, which is going to allow you to walk better and feel better. And then what we do is, just like any medicine, right? We can check back in. I would recommend that you do these 3 45-second holds in whichever direction was best, 4 times-ish a day. Obviously, you can customize that if you want. Timed appropriately, whatever it makes most sense. Maybe if getting up first thing in the morning again is a problem, do it on the edge of your bed. These are just ideas. I think you're picking up what I'm putting down. And go ahead and test this for the next 7 days. So only do that one motion for the next 7 days. And then what I want you to do in 7 days is you can come back and comment if you want, but go and check that yucky back bend. And if you've recorded at the time of this video and kind of taken a snapshot of that, maybe you write it down, go back and look. Does it feel same, better, or worse? And if the back bend is improving, then it tells you you're on the right track. Don't take another pill. Don't look for another medicine. This may be the only one that you need. And if at any point, right, the motion which you're doing as medicine becomes yucky, makes you feel sick, meaning doesn't make you feel good, it starts to hurt for whatever reason, you can always test another motion. We can always find other motions to explore. If at any point something, weird happens there, you just stop it, okay? And if upon retesting, if there's no better back bend, if there's no change in the back bend or the back bend's worse, then we have to go what I call hunting for motions. We've got to plug another movement into that test, treat, retest process to find what's going to be best for you. But for most people, if you've got a yucky back bend, the most logical first place to start is by doing the opposite of that which makes you feel worse, which is forward. Forward center, forward to the right, forward to the left. Then if upon test, treat, retest, it works immediately, you bottle it up, you snack on it, and use it as medicine. After 7 days, you come back. Overall, is the trend same, better, worse? You make your decisions based off the data and the logic, not the emotion of what you or I think or feel or what someone else says. You prove it for yourself using that process. Hopefully this was valuable. If you are confused because you're like, you know what? That motion either didn't help me or bending backwards wasn't really a problem, and you want to figure out what the most likely source is or find other better ways to treat it, then go ahead and check out my other videos to determine the most likely source and then go from there. Thanks so much. Let me know your thoughts below in the comments.